everyone, good afternoon. It's Catherine Wallace here at the Registered Nurses Association of Ontario, and thank you for joining us for this month's Best Practice Champions webinar series. I'm delighted to have Sare Lee from Tilbury Manor Nursing Home joining us today. We are, as you may know, the RNAO has the Best Practice Champions Network, which focuses on guideline implementation and the steps involved to ensure successful guideline implementation. And as part of that Champions series, then we also offer these monthly webinars as an opportunity to look at individual examples of how organizations have taken best practice guidelines and implemented them into their practice. So our webinars are meant to be an opportunity to highlight the work that's happening in the community, and today we'll be looking at it in the context of long-term care. And as a way then of learning from others as to what's been effective, what lessons have been learned. We want for today to be as interactive as possible. So there is, you'll see a chat box that allows you to ask some questions. You should be able to hear me right now and see Sare's slides. And we usually have the presenter do their presentation first, and then there's an opportunity for questions at the end. So please, if you have any during the course of the presentation, be sure to type those into the chat box using the All Participants option. So what I'd like to do then is just introduce Sare to you and to tell you about the focus of today's webinar, and then I'll turn things over to Sare. So Sare Lee has been a registered nurse since 2004 and has been employed with Tilbury Manor for the past 12 years. She has extensive experience as a frontline nurse and has obtained additional training and certification in areas such as wound and skin care, and she is also PIECES trained. She's led a number of committees, such as the Skincare Committee, Infection Control, and Continence Committee at Tilbury Manor. And she was fortunate to be awarded the Director of Care position in October of 2014. And in 2 years, very impressive, since being the Director of Care, then she has led her team in the implementation of 12 clinical best practice guidelines and 3 healthy work environment guidelines, which is really impressive. And she has used the guidelines, and her team have used the guidelines to improve resident care outcomes. And they're very excited that they have been named one of our pre-designate best practice spotlight organizations as part of the long-term facilities. So the focus today of today's webinar that Sare is going to be describing how, as the Director of Resident Care at Tilbury Manor, she has strategically integrated best practice guidelines implementation into existing nursing programs to the benefits of residents and to staff, and to also use the process to address service gap goals. So I'm delighted to introduce Sare Lee to you and to have her webinar presentation. So Sare, please take it away.
Thank you. And good afternoon, everyone. Once again, welcome to today's Knowledge Exchange webinar on integrating the implementation of best practice guidelines into long-term care nursing programs. Tilbury Manor was asked to share our strategies for successfully implementing multiple best practice guidelines and sustaining change. Our hope is to assist others with making the implementation process simple and to help maximize positive outcomes. So the objectives for today's webinar is to review the Ministry of Health required program areas, the clinical best practice guidelines, review the implementation of a best practice guideline. Participants will be able to integrate implementation process into required program areas and integrate into quality improvement plans submitted annually to HQO in the LIN. Participants will be able to utilize a gap analysis to help meet requirements of program evaluation, mandatory education, and build a quality improvement plan while providing evidence-based care. So where do I start? What can we improve? What are we doing well? How can we ensure all of the requirements of the Long-Term Care Homes Act are met? These are all of the questions running through my mind as I embarked on my new journey as a Director of Resident Care. We seem to compartmentalize all of these tasks. Over here, we try to provide good care, and then over there, we're trying to do our quality improvement plans while trying to still provide education for our staff, and then we need the programs for regulations such as falls prevention, wound and skin. So luckily, I reached out to my RNAO LTC coordinator, which helped focus our team's efforts on problem identification, change ideas, interventions, monitoring and sustaining change through the use of a best practice guideline and gap analysis tool. This process worked so well that we continued to integrate the implementation process into all of our required program areas. I've created this presentation to assist in explaining this process of integrating the PPG implementation into the LTC Homes Act requirements of the nursing programs. So Long-Term Care Homes Act requires every long-term care home to have a program for falls prevention and management, a program for skin and wound care, a program for continence care and bowel management, and a program for pain management. These programs must be evaluated and updated annually in accordance with evidence-based care. All of the required program areas, plus restraints and PASD use, must also require training and re-education annually. Every long-term care home must have a quality improvement plan. These plans must be interdisciplinary and include goals, objectives, evaluations, policies, procedures, and protocols. Care must be provided in accordance with evidence-based practices. So that was the LTC Homes Act requirements surrounding required program areas. Now here is the list of the clinical best practice guidelines from RNAO. You can start to see how these guidelines could help influence your required program areas, such as the risk assessment and prevention of pressure injuries, the assessment and management of stage 1 to 4 pressure injuries, and the assessment and management of foot ulcers for people with diabetes guidelines. These guidelines will all help influence and shape your required program area for wound and skin. So how do I ensure our home meets all of the requirements of the Long-Term Care Homes Act and provide evidence-based care? Many nursing leaders and supervisors in long-term care feel overwhelmed by the amount of requirements for programs, assessments, and evaluations of these programs, education, and ensuring quality evidence-based care. So Tilbury Manor had created a strategy that takes all of these areas and simplifies them into one process. The use of the gap analysis tool really starts this process. So what is a gap analysis? It's a tool which compares your organization's current practices with evidence-based practice. Many of the clinical best practice guidelines have the gap analysis worksheet tool. A gap analysis is part of the groundwork to developing the goals and objectives for a program, as it gives you the opportunity to equate what is already happening in your organization compared to what best practice recommendations are. A gap analysis ensures you are working in accordance with evidence-based practices and helps you to discover areas in which you want to improve practice. Completing the gap with your implementation team or program team or champion team, whichever you call it, is a good way to get different perspectives on current practices within your organization and to establish priorities together. Invite your RNAO LTC coordinator to assist your team with completing your first gap analysis. The RNAO coordinators come with a lot of knowledge, experience, and can reach out to other experts across the province for change ideas and strategies. This is an example of a gap analysis. The recommendations listed in the best practice guidelines are based on the most current evidence. These recommendations you will see on the left-hand side of the gap analysis tool, and there's the red arrows pointing towards them. Underneath the notes section found on the right-hand side, your team can add items that you are doing well or areas for improvement, including your goals. So these were the steps that we took to implement best practices within our home. First, you assign a champion or a committee leader that is dedicated to improving resident care. They have to be motivated and empowered to lead others. They can provide education and support to their peers. Each Ministry of Health required program area should have a champion leader and a committee of inspired staff members. Provide time for champions to prepare and perform education assessments, implementation of best practice changes, the monitoring and screening of evaluations. And for our home, Tilbury Manor, we have a 75-bed home. We provide 1 day per month for each champion. The champion committee will be dedicated to lead your required program area. These champions and committees should have a good understanding of all of the requirements of the Long-Term Care Homes Act for the required program areas and should have a good understanding of all the facility policies and procedures pertaining to the required program area. Ensure to collect baseline data to monitor your progress towards improving care and report this data back to the DRC. You have your champion schedule a meeting with the interprofessional committee members to initiate the first evaluation of the required program area using the gap analysis tool. Again, be sure to invite your RNAO LTC coordinator to help facilitate this process. The gap analysis will help focus your team on specific areas for improvement and which areas your team is doing well. Once your team has completed their evaluation, have them meet again to create a goal and action plan based on the gap analysis evaluation. This should include practice changes and education for both staff, residents, and families. Have your champion committee leader create education sessions based on the needs of your staff. At Tilbury Manor, the champions created 2 presentations, one that was directed towards registered staff and one that was directed towards personal care staff. The champions should then also meet with community partners to assist with educational materials. For example, your continence champion should connect with your continence product service provider. Then you would schedule education days for all staff. Try to make these days as fun as possible to help staff become engaged in this new process. The champions and the committees should roll out strategies to improve during education sessions. Ensure that practice changes can be built into documentation system. This helps with sustainability and puts ownership and accountability back to the staff. Shown here is an example of our documentation changes. Previously, oral care POC stated oral care done or refused. Now, to meet best practice and to ensure compliance with software changes, we created the following. Was a visual assessment of the oral cavity completed? Was teeth brushed? Was the mouth rinsed? Was lip moisturizer used? And was any abnormalities of the oral cavity noted? This also helped with care planning, and it just helped the staff to recognize what kind of items they should be looking at when they're providing oral care every day. Create an audit schedule for your registered staff to monitor practice changes on a continuous basis and ensure compliance. This champion should then be monitoring for positive effects and improved outcomes. This is an example of an RN audit schedule. So you see on Sunday they audit all of the continence products. On Monday they're doing a weight audit. Tuesday, medication change audit. And then also to the other side is an example of a restraint and PASD audit. So when they're doing one of the PASD and restraint audits, they're looking at the type of restraint or PASD. Do we have consent? Do we have a doctor's order? And was their assessment form completed? Champions should create educational pamphlets for residents, families, and visitors so that they can be informed about best practices and your strategies to improve resident care. All staff should be reassessing and reevaluating practice changes. Your team may need to re-educate or look at different ways of delivering evidence-based care if the current way is ineffective. Ensure that your team has a successful interdisciplinary referral process. All staff should feel confident in making a referral to any champion or committee member with ideas on how to improve resident care or when a reassessment is required. Build practice changes into policies and procedures and into job routines. Using this process, your team will be able to implement several best practice guidelines at the same time. This process can be applied to other nursing areas that are not considered a Ministry of Health required program area, but are still monitored by compliance and are essential to the residents' health and well-being. These areas being BSO, oral care, personal and family-centered care, end of life and palliative care, and restraint PASD use. Every April, a quality improvement plan must be submitted to Health Quality Ontario as directed by the LHIN. With the implementation process previously described, the QIP work plan is already completed when your Homes Committee created the Goals and Action Plan. The Goals and Action Plan then just needs to be transferred into the work plan template from HQO. So this is a summary of all of the mandatory items completed with the use of the RNAO gap analysis tool. First, that the Ministry of Health required program area committees were formed. Assessments, evaluations, and reevaluations of all required program areas and other nursing areas were completed. Meetings of the committees, education of all required program areas and other nursing areas, continuous quality improvement required by the Ministry of Health, and quality improvement plans required by HQO and the LHIN, and best practice implementation and providing evidence-based care. So I would like to take a moment now to see if there's any questions before I go into specific examples from Tilbury Manor's experience with this process. Did anybody have any questions?
I don't see any in the chat box there, so perhaps you continue, and then we'll have some time for questions at the end of your presentation. Thanks.
Okay. So to further explain the process of integrating nursing programs and implementing best practice guidelines, I would like to share some of our team's experiences. For this example, we will focus on falls prevention and management program. So number one, we started by selecting a registered staff that was passionate and dedicated to reducing falls. We provided 1 day per month to complete champion leader activities, such as evaluation of the program, goal and action plan creation, screening, monitoring, education, reporting, led practice changes, care planning, and audit for compliance of care and documentation. We set up a meeting between our champion leader, the Falls Committee, and the RNAO LTC coordinator. The RNAO LTC coordinator assisted in focusing the team on best practice and led the evaluation of the program through using the gap analysis tool for prevention of falls and falls injuries in the older adult population. We combined our falls prevention program with our alternative to restraint and PASD program. Therefore, we also completed the gap analysis tool for promoting safety alternative uses to restraints. We created committee binders for each program that followed the same template. By following the same template through every committee, it helped with the sustainability and staff understanding what the new processes were going to be. So in these binders, we had the Ministry of Health requirements surrounding the program area in the first section. The next section was the policies and procedures. The next section was the goals and action plan. Then screening, monitoring, assessments. Then the interdisciplinary team referral forms. And finally, the educational materials. Step number 4, the champion leader then created a PowerPoint presentation for PSW staff and one for registered staff. The PowerPoint outlined very specific education topics based on an assessed needs of the staff. During Nurses Week, we had an education day where all staff received education from all champion leaders by rotating through stations. During education, we rolled out practice changes. For example, with falls, an enhanced post-fall assessment was created, and the post-falls huddle and staff were educated on proper footwear as well. Step number 5, changes to our software were completed prior to education sessions to increase compliance with using the enhanced post-fall assessment. This assessment now includes specific questions relating to variables rather than a narrative box in which nurses could forget to comment on these variables. Number 6, the champion then created educational pamphlets for the residents and families so that they can be informed of best practice guidelines and changes to care. The pamphlet information for falls prevention and management included proper footwear, the least restraint, and fall prevention strategies. Pictured there is a number of our pamphlets that the champions had created. And this is a picture of some of the information that was contained in our falls prevention pamphlet. An audit schedule was created for registered staff and built into their job routine. Falls audit includes, was a post-fall assessment or a huddle completed? Was an incident note created? If unwitnessed, was a head injury routine initiated? And was interventions to prevent future falls added to the care plan? There was an audit created for each nursing required program area, as well as oral care audit and restraint PASD audit. The RN report template was also created to improve communication amongst leaders and team members. All audits and reports are shared with the DRCs at the end of the day. Trends are measured and discussions regarding audit results happen during nursing team meetings. Number 8, each champion leader has created a spreadsheet to track our progress over time and can help focus our change ideas for improvements. Some of these items captured for falls would be the number of falls that happened in the month, the number of residents with reoccurring falls, what time of days do these falls occur, and where are falls occurring. This can help focus our efforts for the next year's goals and action plans and education. Number 9, nursing policies and procedures were revised based on best practice guidelines and ensured to capture new practice changes. Number 10, during our education sessions, all staff were introduced into the interdisciplinary team referral process. All staff were encouraged to submit referrals to all programs when they had an idea for improvement for the residents or when a resident required further assessment by committee members. And number 11, our team then enhanced their skills regarding professionalism, leadership, mentoring, team building, and conflict management by completing the gap analysis process with the healthy work environment best practice guidelines. During staff meetings, there was a facilitated discussion led by the DRC and LTC coordinator to build on their self-assessment of the healthy work environment. This was the last step to our home strategy in implementing BPGs. However, this process never ends. It is a continuous quality improvement strategy. So the outcomes that we've seen since using this strategy: improved resident satisfaction, improved staff satisfaction, and improved resident outcomes and quality of life. Our team's seen many positive outcomes from following this strategy. This created buy-in from our staff. Because we followed the same process for all of our champion teams and built evidence-based practices into policies and procedures and developed software changes that encourage compliance with practice changes, the culture and the way that we provided care to our residents had improved. And here is the list of the positive outcomes that we have seen here at Tilbury Manor. Newly acquired pressure ulcers went down from 9% to 0. Worsening pressure ulcers went from 10% down to 0. Resident falls from 15% down to 12%. The use of restraints from 17% down to 4%. UTI infections went from 2% down to 0%. Resident reports of daily pain went from 4% down to 0%. And resident reports of worsening pain went from 18% down to 9%. And then, of course, we improved resident and family and staff satisfaction. This is a diagram to further explain the continued annual process our team follows to further implement these guidelines and create new quality improvement plans each year. So in December, the team evaluates their program with using the gap analysis tool. Again, more committee members and more staff members and the RNAO LTC coordinator that you can bring together is going to give you more points of view. In January, they create goals and action plans based on recommendations from the gap assessment. In April, the quality improvement plan is created based on the goals and action plans that were made in January. In May, all of the staff are educated on all of the required program areas. In June to November, we're doing reassessing and reevaluating practice changes, monitoring progress, and track improvements and successes. We may need to re-educate during this timeline or take a look at our processes and revamp them, but this is the normal timeline of how we're continually implementing best practice guidelines. So once again, the value in this process: you satisfy requirements of the Long-Term Care Homes Act, you improve resident outcomes, increase nursing knowledge and skill, empower frontline staff to be leaders. Cultural change: we improved morale and interprofessional collaboration in the team. Implementation and annual reevaluation of 12 clinical best practice guidelines, all within a very short period of time. We've heard that many homes have difficulties implementing one best practice guideline because it seems like a lot of work. So Tilbury Manor made this strategy by utilizing all of our job routines that we have now and working in this process into those job routines, into the policies and procedures, so that it was just a everyday, this is our job routines. So it made it easy for staff, and it improved the buy-in from staff. We improved resident and family satisfaction, and we laid the groundwork for becoming a best practice spotlight pre-designate home. So there is a picture of our champion team in the bottom left-hand corner. And then there's a couple of pictures of our best practice spotlight kickoff celebrations. And I'll ask again if anybody has any questions from our process or the strategy.
So thanks for that presentation, Sarah. We did have a question from Jennifer wondering if it's possible to get copies of the pamphlets that your champions made. You were able to see the inside of one, so.
Yes, of course, we're always willing to share information. And so this next slide just, again, thanks everybody for their participation in today's webinar. And it also gives the contact information for myself and for Beverly Fulber. She's our RNAO LTC coordinator. So if you email either one of us, we can get you that information.
And perhaps, Sarah, when we send the follow-up evaluation form, we maybe could include one of those pamphlets with a PDF. And then participants will be able to see an example, and then perhaps if they're wanting further information, they'll have your email address to connect with you if they wish. Now we have, I see, some more questions coming in fast and furious. So Lucia asks, was there any pushback from staff, as in another thing we have to do? Because you identify that the role of champions is being key to this process, a process that you have very nicely streamlined. It's very organized, and you say you've made it very much a part of the everyday job routine within the home, which I think is a credit to the success and the number of guidelines that you've implemented. But it is a lot of work to create educational resources, be involved in assessment and evaluation. So Lucia's question of, was there a lot of pushback, resistance initially?
We did not have any, but again, you have to really connect with those individuals that are going to be your champion leaders. I had a lot of one-on-one discussions with each champion leader, tried to explain the process that we're going to go through, and that every champion leader has each other to lean on, because they're all doing the same process. And I think that part really, really helped, that they were all speaking the same language, even though their specialties are different required program areas, but they're all speaking the same language when it comes to best practice implementation.
So you felt then that having then a consistency in the messaging, that helped with buy-in. I think, though, you're also identifying the importance of leadership from the champions and the leadership that you gave them as the director, and as well being the director, then having that leadership yourself. Sarah, can I ask, you identify then as being a staff member initially at Tilbury and then went on in 2014 to become the Director of Care. Was that something that worked as an asset in this process of having been in the past a staff nurse?
Yes, I think that's what I've always told Bev. It's been a series of very fortunate events that I had got the opportunity to work with every one of the very hardworking, dedicated staff here at Tilbury Manor, and I got to work and know them on a personal level. And so when I came into this role and position, they had already kind of known me as a nurse and as a colleague. And so there was no real pushback. Everybody here wanted to improve resident care and to provide the best that we can. And it was very simple for me. And I think that's probably a big reason as to why, is because I worked with them on the floor.
Yeah, I think that, wow, to hear that it was a simple process is refreshing, because it is a lot of work. And your results indicate then the outcomes, the impact that work has had. So kudos to you for that. Suzanne asks if she can have a copy of the slides from this presentation, and we are recording this, so it will be archived and available on our RNAO website, so others can access the slides and the presentation today at a later time. And Mandy thanks you for the presentation and the process that you used. Lucia wonders about, is the protected 1 day a month just for the leader? Did the team members also have time to work on the implementation strategies? And I'll add, if I can, was this paid time?
The 1 day a month for the champion leaders is definitely, it's a paid time. It is off the floor and away from their other duties so that they can focus on the committee and the activities of the committee. But the committees themselves, when they meet to do the goals and action plans, or when they're meeting quarterly, it is not paid time, and it's just volunteered individuals that wanted to be a part of those committees. And again, we had no real pushback and a lot of participants that wanted to be a part of committees. And then when they started to see a lot of the successes coming out and a lot of the improvements, even more people wanted to be a part of these committees.
That's impressive. I think that says a lot about the staff, that they're willing to give of their time. And I think then you're saying that once they saw then the outcome and the positive impact it had on staff and on residents, and you gave some great examples quantitatively of the impact that the guideline implementation has had, that then furthered their commitment and others to be involved in this work. We have another question saying, I see that you are designating a registered staff as a champion, I think, and I believe the best way to have success in this is if a champion is continued in her particular area. My question is, the champion works as normal shift or as designated staff who does the assessment, planning, implementation, and evaluation? I think you've indicated that they have, for the rest of the month, they're doing whatever their job description would be. And do you think that that's the best way of having someone whose sole job is to do the champion's work, or is it best that they have the blend of their regular duties within the home as well as the champion role?
I think the blend is definitely what was best for Tilbury Manor. I can't speak for other homes whether or not it's going to be, but it's because then they're the leaders on the floor every day throughout care. They can continue to instill the knowledge and the skill in frontline workers. That's really helped too, is that they then go back to their off the floor or back onto the floor duties, and then they can spread that education and knowledge with others. And as I said, there's multiple champions, and you can see them from our last slide here in the bottom picture. There is multiple champion leaders, and so as I said, they really rely on each other too if they have any questions, concerns that come out in the process, or how to engage people more, or what kind of educational topics should come up. So they have each other, and plus also the committees. But
your example is a good one in that they work on this for one day a month, but then there's a lot of the follow-through that happens on a daily basis. And when we think about successful implementation, it is about that change in practice at the point of care. And so then they're able to follow through with that with staff. And really that's where maybe some of the best questions maybe come up, where people are asking, today in this situation with this resident, how should I be providing care that's consistent with best practice guidelines? So wonderful work.
Right. So they were all educated, but then also the one piece that I wanted to highlight too is that the charge RNs that work every day on the floor are doing audits every day on these areas to ensure that the practice changes are being sustained and that we're following up with practice changes. So they're doing audits, as I say, on weights, doing audits on restraints, audits on wounds, audits on medication changes. There's a number of different audits, and they're all by schedule. The RNs then also do an RN report template that tells them what's kind of going on in the building. That's how they do their report to each other, and then I, at the end of the day, get that report so that I know what's kind of gone on throughout the last 24 hours.
And so what you're describing is a very standardized process where everyone knows then when the audits are going to be conducted. Have you found then, this is a question somewhat related to what Lucia's indicated, that has then improved the response? Because sometimes staff can feel threatened or judgment as far as an audit process. So have you found that the uptake, the response to the audit findings has improved because it's been standardized?
Yes, because it's been standardized, but also because we take a positive approach on it. When we do the audits, we highlight all of the positive outcomes that's come from it. All of the items that we did, we met, and all of these successes that we're seeing, we really highlight on those. So we try to make the audit system not about a negative, but about a positive.
Wonderful. And I'm wondering, you have a number of quantitative outcomes. I'm wondering how those were communicated to stakeholders. How do your residents know about, the reduction in falls rates? And what about for staff or for funders or community partners? How have you shared that information?
So we have residents council that we discuss at resident and family council. We also have information sheets at the front desk that go along with the educational pamphlets. It's also inserted in some of the educational pamphlets, some of the successes that we've seen. We've done an article with RNAO. We've done a lot of local articles too in the Chatham-Kent senior magazines and that things, just to get the word spread about the successes that we've had at Tilbury Manor.
Wonderful. And you mentioned that you had an educational day for staff. We know that education is one of the most commonly used implementation strategies. Can you tell us a little bit more about what that looked like? And maybe a little bit about, did you have budget for that day, that sort of thing?
Yes, so we budgeted for 4 hours of education for each staff member in the building. So I had the champion leaders got their 1 day a month, and for a couple of months they were working on collecting educational materials, and I created a PowerPoint presentation template, so they would just have to insert their educational materials into this template. They did 2 PowerPoint presentations, one for the personal support worker, one for the registered staff, and really tried to focus the areas based on what came from the gap analysis. What are our gaps? So that's what their education was focused on when we looked at these 2 presentations. So then each staff member was put into a group and rotated through so that they all got each presentation. There was 8 of them. So they were rotated through, got 20-minute presentations on each required program area that was very specific and tailored to the educational needs of the staff here. During that, we actually did that on Nurses Week too. So we provided lunches for all of the staff members, and we did draws throughout the day as well to make it very fun and interactive. And what else can I say about the education? Oh, and then also after, for those individuals that were on vacation and couldn't make the education days, or for staff members that were hired after the education days, we keep those presentations that the champion leaders created on file, and everybody has to review those presentations. So it's an ongoing education. Even though the education was specific on 2 days in May, we still have that as an ongoing education session.
Wonderful, because that sounds like a lot of work that the champions put into these presentations, and certainly to have them available as a resource beyond that day is an asset to everyone. And you indicated this was available to all staff, so that included dietary, did that include housekeeping?
Yes, it was. It was mainly focused towards a lot of nursing, though.
Nursing staff. Okay, okay. I'm just looking if we have any more questions. Yeah, you've been, so since October 2014, then you've implemented a total of 15 best practice guidelines. How have you been able to sustain? Because this is a lot of change, and we talk about that so you can have, you have to be mindful of having too much change all at one time. So how have you been able to sustain the change? What do you think have been some of the key factors that have helped to sustaining this change?
I think there's probably 4 major factors that go into that. One is that we built it into the policy and procedures at our home. 2, we built it into the job routines. 3, the documentation software changes. So they're documenting the way that we should be by best practices. That helps them be aware of best practices in those specific areas a little bit more as well. And then also, just because we have some great staff at Tilbury Manor that are, I couldn't say enough great things about the dedicated individuals here at the home. It's just been a very simple process for us. I know that it's a lot difficult at other facilities, but our staff are wonderful.
And staff, again, that obviously feel and have the leadership skills in order to take this forward, and the support from management from yourself. It's wonderful. So again, just looking to see if you have any other questions. I'm also noticing just in the photos that we have that your long-term care coordinator, Bev, is featured in the picture. Do you want to tell a little bit about how she's helped the home in moving forward with guideline implementation?
Bev she's an expert. She's a wealth of knowledge, and if she doesn't have information, she can reach out to a number of other individuals that might have that information. She's worked with other facilities in the area, so she can bring that knowledge back to our home as well. She sits with our team, and it's only honestly taken about an hour every week with our team, where she'll sit with one committee member, myself, the committee, and she'll go through a gap analysis and really explain to us about what it was to meet that, what it means to meet that recommendation. And then she helps us focus our efforts on making new goals and what we can do to improve the work that we perform.
So it sounds like that is that consistency in her support, and again, just the organization that you have in this process, using the gap analysis really as foundational to making changes, using that as the rationale for changes, and then linking that to your quality improvement plan.
Right.
Yeah, wonderful work, wonderful work. Any other, I'm just going to wait to see if there's any other further questions. I'm just wondering, maybe as a final question, as a pre-designate BPSO, how do you think that overall it has helped the home as far as just moving forward with quality improvement? What benefits do you think overall it's had? Perhaps we have some on the webinar today who are considering applying to become a best practice spotlight organization in the area of long-term care. What would you say to them?
Well, it definitely improves resident outcomes in the care that we provide to our seniors. The staff knowledge and skill, I think our team has actually come close together now too, and works really good with each other, especially with the interdisciplinary team referrals. Resident and families are very pleased with all of the care that we provide. I actually haven't even had a complaint or anything that comes through in over a year. Family and residents are very satisfied with the care. And it really elevated our perspective as others in the community.
And certainly has aligned what you're doing with evidence, and then you're saying that it's also helped with quality improvement and meeting ministry-defined priorities.
Mm-hmm.
Yeah, wonderful. Well, sir, I don't see any further questions, so I'm going to thank everyone for attending today's webinar. And all the participants will receive an email from us requesting just some evaluation of today's webinar. We do appreciate you completing that and giving us that feedback. And then from there, you will also receive a link for a certificate of completion. So we thank you again for attending today and hope that you found this helpful for your practice. I think that Sare has provided us with an example from Tilbury Manor that is very inspirational and speaks of the quality work that they're doing, the support of the long-term care coordinator, and the impact that evidence-based practice has had for the residents, for their staff, as well as for the organization. So again, kudos to you for that, and thank you so much for doing this webinar today. I think it's been very enlightening for all of us. So thank you, Sarah, and thanks everyone for attending today.
Thank you.